Welcome to Section 5 of our training, Lockdown Procedures. In this section, we'll focus on how to respond to situations that require securing the facility, such as intruders or active shooter events. These procedures are designed to protect children and staff by minimizing exposure to danger. Lockdowns are necessary in situations like an intruder on or near the premises, an active shooter event, or nearby police activity that poses a potential threat. The primary goal of a lockdown is to protect children and staff by securing the facility and, again, minimizing exposure to danger. There are two main types of lockdowns. A soft lockdown is used when the threat is outside the building. In this case, all exterior doors and windows are locked, but activities inside may continue while staying alert. A hard lockdown occurs when the threat is inside or imminent. In this scenario, rooms are secured, lights are turned off, and everyone must stay out of sight and silent until authorities give clearance. Preparation is key to an effective lockdown. Train staff regularly on procedures and identify secure areas in each room where children can remain hidden. Emergency kits should be available in every room and include items like flashlights, first aid supplies, snacks, and water. Additionally, ensure communication tools like intercoms or phones are functional at all times. In a hard lockdown situation, follow these steps immediately. Announce the lockdown using your designated system. Secure all doors and windows and lock them if possible. Turn off lights and close blinds or curtains to block visibility into the room. Move children to secure areas out of sight and maintain silence while using calming techniques to keep them at ease. Do not leave your secure location until you receive an official all-clear signal from authorities. The run, hide, fight model provides guidance for active shooter situations. If it's safe to evacuate, run with the children to safety. If evacuation isn't possible, hide by locking doors, turning off lights, and staying quiet. As a last resort, only if lives are in immediate danger, fight by distracting or disarming the assailant. Effective communication during a lockdown is critical. Use predetermined signals like code words to initiate the lockdown quickly. Notify law enforcement immediately by calling or texting 911, but avoid using phones unless it's safe to do so. If possible, provide updates to staff through the intercom system without compromising safety. Keeping children calm during a lockdown is essential. Use a calm tone of voice and avoid showing panic yourself. Engage children with quiet activities like storytelling or games that don't require movement or noise. Reassure them that they are safe and provide physical comfort when appropriate. Regular drills are crucial for preparing staff and children for lockdown situations. Schedule at least 2 drills per year covering both soft and hard lockdown scenarios. Simulate realistic situations such as an intruder in the hallway to test responses under pressure. After each drill, debrief with staff to identify strengths and areas for improvement. Then document the drill for compliance purposes. In wrapping up this section, understanding when to initiate a soft versus hard lockdown is critical for responding effectively to threats. Prepare secure areas in advance with emergency kits readily available. Practice regular drills so everyone knows what to do in an emergency. Finally, remain calm during real events while assuring children that they are safe. Welcome to Section 6 of our training, Emergency Kits and Supplies. In this section, we'll discuss the essential items every childcare center should have on hand to ensure safety and preparedness during emergencies. Let's go. Emergency kits are essential because they provide immediate resources during crises. They support staff and children during extended shelter-in-place situations, ensure basic needs like food, water, and medical care are met, and reduce stress by having supplies readily available when they're needed most. There are several types of emergency kits to consider. Classroom kits are tailored to the needs of individual rooms, while facility-wide kits contain centralized supplies for the entire building. Evacuation kits are portable and designed for use when leaving the facility, and first aid kits provide comprehensive medical supplies for treating injuries. A classroom emergency kit should include basic first aid supplies like bandages and antiseptic wipes, non-perishable snacks and bottled water, a flashlight with extra batteries or a hand crank flashlight, comfort items such as blankets or small toys to soothe children, and emergency contact information for each child. It's important to note that state and local regulations may have certain requirements regarding the contents of first aid kits. A facility-wide emergency kit should include a large supply of food and water sufficient for at least 72 hours. It should also contain extra blankets or sleeping bags, sanitation supplies like gloves and trash bags, communication tools such as two-way radios, and copies of your emergency action plan for reference during an emergency. An evacuation kit should be portable, such as a bag or a backpack, and include essential items like identification tags or wristbands for children, a whistle or signaling device to maintain group safety, a map with evacuation routes clearly marked, and a portable first aid kit. A well-stocked first aid kit is critical in any emergency. It should include adhesive bandages in various sizes, antiseptic wipes, antibiotic ointment, gauze pads, medical tape, scissors, tweezers, gloves, and any necessary medications such as EpiPens for children with severe allergies. Emergency supplies should be stored in locations that are easily accessible to all staff members. Protect supplies from moisture or extreme temperatures to ensure they remain usable. Clearly label each kit based on its purpose, for example, classroom kit or evacuation kit, and conduct regular inspections to replace expired items. Maintaining emergency supplies is an ongoing process. Check expiration dates on food, water, and medications at least quarterly. Replace batteries and flashlights regularly to ensure they work when needed. Update emergency contact lists annually or whenever changes occur. Finally, restock any items used during drills or actual emergencies. In this section, we learned that different types of emergency kits serve specific purposes, such as classroom versus evacuation needs. Each kit should include enough supplies to meet basic needs for at least 72 hours. Store these kits in accessible locations known to staff members and inspect them regularly to ensure that they're stocked with fresh supplies and accurate information. Welcome to Section 7 of our training, Recovery and Post-Emergency Actions. This section focuses on what happens after an emergency, including reuniting families, supporting children emotionally, and learning from the experience to improve future preparedness. Immediately after an emergency, your top priorities are ensuring that all children and staff are accounted for, providing first aid to anyone who is injured, contacting emergency services if necessary, and communicating with families to inform them of the situation. Reuniting children with families is a critical step after an emergency. Designate a safe reunification area away from hazards, verify parent or guardian identity using sign-out sheets or photo IDs, and maintain calm, organized communication with families. Be sure to document the process for accountability. Children may experience emotional distress after an emergency. Look for signs such as crying, withdrawal, or clinginess. Provide reassurance through calm words and actions. Engage children in comforting activities like storytelling or drawing, and communicate with parents about their child's emotional needs so they can provide additional support at home. Staff members may also experience stress or trauma after an emergency. Acknowledge their feelings and offer access to counseling or employee assistance programs. Encourage team debriefs where staff can share their experiences and emotions in a supportive environment. A post-emergency debrief is essential for learning from the event. Gather all staff members as soon as it's safe to do so and review what happened during the emergency. Discuss what went well, what challenges arose, and identify areas where procedures can be improved. Document these findings to update your emergency action plan. After an emergency or drill, it's important to update your emergency action plan based on lessons learned. This might include revising contact lists, evacuation routes, or supply needs. Share these updates with all staff during follow-up training sessions to ensure everyone is informed. Also, confirm that your plan remains compliant with licensing regulations. Effective communication with families after an emergency is crucial. Provide clear information about what occurred and how it was handled while reassuring them that their children are safe. Share resources like counseling services if additional emotional support is needed. Invite feedback from families on how the communication could be improved in future situations. Returning to normal operations requires careful planning. Inspect the facility for any damage before reopening classrooms and restock any emergency supplies used during the event. Resume regular schedules gradually to help children adjust back to routine while monitoring their behavior for lingering signs of distress. In summary, recovery action should prioritize safety by accounting for everyone immediately after an event. Support emotional recovery for both children and staff while learning from each experience through debriefs and plan updates. Finally, maintain open communication with families throughout the recovery process to build trust and confidence.